Hello, everybody. Welcome back to The Bleeding Truth. My name is Sally McNally. I'm the Irish midwife.
And I'm Bridget, Sally's daughter.
Today, we had the most interesting conversation with a professional in breastfeeding education.
We talked about really great topics such as lactation problems, nipple piercing, latching issues, social norms, and all different types of issues that you might face if you are a first time breastfeeder as a mom. So stay tuned because this is a podcast that you don't want to miss.
And today, we have a very special guest. I want to introduce my very good friend, Sheila Dietrich. She is a board certified lactation consultant here in Ventura, California. We think of her as our guru of breastfeeding, all things breastfeeding. She is the hero, the heroine to many, many women here in town. And we just are so honored to have her come talk to us today. Welcome,
Well, thank
Sheila.
you, Sally, and thank you, Bridget, for having me.
Thank you. I think this is going to be a really fun episode. I have a lot of questions, but I think to get it started off, Sheila, could you share a little bit about how you got into this career path and what is your bleeding truth when it comes to breastfeeding?
Absolutely. Thank you. I really feel like I have to start with my own birth. My mom, born on the farm, so to speak, as well as my dad, all born at home, all breastfed. She turns 18. She goes out to California on her own, meets my dad. So she had none of the support that she had. Great deliveries, but breastfed my sister for a very short time, at which point she was told, you can kill a baby, with diarrhea. So I said, well, what did her stools look like? And my mom said, oh, they were really horrible. They were yellow and runny. And I said, well, Mom, that's a normal breastfed stool. But when I came along and my brother who followed me, she was scared to death to even breastfeed.
Oh, wow.
And my heart goes out to her because as time went on and she saw her own daughters breastfeeding, she said, I really thought that I would harm you to breastfeed. So I really felt passionate about breastfeeding. My sister was the first to have babies, and I saw her breastfeeding. And of course, I was already a nurse. I actually became an RN at the age of 20. And so I saw that there weren't, even in the late 70s, early 80s, a lot of people who were, as I was working in labor and delivery and breastfeeding comparatively, but it was something I knew I wanted to do. And so I had my own passion there and breastfed my own daughters. And then their baby, I was the one people would always come and get and say, you're good at latching these babies. Can you please come and put this baby on for me? I can't get the baby to latch. And I don't know why I was good at latching babies, but I just was. So flash forward a few years, and somebody came up to me and said, they've got this scholarship where you can become certified in lactation and you should apply for it. It was somebody at work. So I did, not thinking I was ever going to get it, and I did. And that's when I became a CLC, which is a certified lactation counselor. And that was a 1-week course. And from that point on, I ended up getting the job where I currently work. And I then became very interested in becoming an IBCLC. An IBCLC is a board certified lactation consultant. And a lot of people wonder, well, what's the difference? So a CLC, you have about 40, 45 hours of education, and then you take an exam. An IBCLC, you need 300 to 1,000 hours of practice. And you also need 90 hours of training. And then you sit for boards. And for those of you who are RNs like Sally and I, it's like taking state boards. It's very, very scary. You go down and it's structured and monitored, and you have to pass the exam. So a board certified lactation consultant is who people want to see when they're having actual difficulties, different problems, as compared to a lactation counselor, which can help with many of the kind of normal breastfeeding issues. But we kind of have that step above in education, experience, and knowledge. We're like little investigators, and we're trying to figure out what the problem is, and using evidence-based research and all of our knowledge about the body, the way the body works, both the mom and the baby, to put those two together and make it happen. So that's how I ended up with my passion. I did work labor and delivery for decades, and I remember always wanting to put the babies straight away, skin to skin. And back in the old days, of course, you would have even some of the providers that were delivering the babies, they'd want to put the baby on the instrument table and do their exam, or we'd take the baby over to the warmer, right? And there was a short time that I thought, how special is my job that I'm the first one that gets to see this baby? And then I realized how wrong that was, because it really shouldn't be me. It should be the mother, and the baby belongs on the mom. And so I was trying to pioneer that long before it became the norm, with some pushback, of course.
And I just want to jump in here to say that you look like a beautiful, gentle little woman, but I know you are a powerhouse. And I know the amount of pushback that you've had to deal with throughout the years. And you've done an amazing job. Um, Sheila, tell us a little bit about the baby friendly initiative that you brought to the
Sure.
hospital.
Well, baby friendly is it's an international certification or designation, they call it, that facilities that are birthing babies can acquire. And it does not come easy. It actually took us several years. And I'm honored that you said I brought it to the hospital, when indeed I did not. I was the chair of many committees for it, but there was definitely it took a lot of people to make this happen. I was a part of it, but not certainly
Yes,
all of it, or even,
yes.
Um, so we have this wonderful director of maternal child health, where I work at Community Memorial in Ventura. Her name is Megan, and she had this huge passion. Her passion was as strong as mine, and she was the one that allowed all of this to happen. And so it took us, like I said, about 3 or so years to meet all of the requirements of baby friendly, and we did achieve it. And now we're actually on the cusp of our redesignation, which I've been working quite strongly at, because we redesignate. We've been 5 years next year, and so we're going to redesignate them.
Wow.
So baby friendly requires that you do have a policy in place for how babies are fed in your facility. And that was one of the things that Baby Friendly came about. It was called the Innocenti Declaration, where all these great minds all over the world got together, and they said, what are we doing in birthing facilities that are not allowing moms to meet their breastfeeding goals? Or their feeding goals, because not everybody has a plan to breastfeed. But what we realized is that people were being undermined. And part of that undermine is what I talked about. We were removing babies straight away. We were taking them over to a nursery. We were separating them from the mother.
Right.
Our infant feeding policy, we worked long and hard at to get it exactly the way that it needed to be. And it was approved by the Baby Friendly organization. And the step 2 of Baby Friendly is that all of the staff have to have education about how to help parents meet their feeding goals. And that was a biggie. And Sally, I'm sure you remember that. 15 hours
yes.
of didactic education,
Yeah.
and 5
Yeah.
hours of skills competencies. So, and the providers have to have at least 3 hours of education. And anybody that comes across the patient has to have education. So, even all of the staff at the hospital that are working in radiology or anywhere else, it's built into their annual marathon about what is baby friendly and what can we do when people come in.
It was a monumental
Yes. clinics. We set up education there, so all the moms coming in are educated before they even deliver. So, and so on and so on. So
Yes, yeah.
it's quite comprehensive. There's actually 10 steps, but it was a big
Oh,
undertaking, and we did it. And it was a group effort, and there
yes,
were so many people involved, and I was so proud of
yes.
everybody. So,
So wonderful.
yeah.
And all of the babies that have benefited from that,
Mhm.
and the women who now, as you say, they're educated a lot before they come in to have their baby. So they come in expecting to be breastfeeders
Mhm.
instead of coming in thinking, I'm going to bottle feed. And then there's this like back and forth,
Right.
like, well, breastfeeding is good, but they've already been ingrained. So I think that it's so wonderful the work that where you work, the New Parent Resource Center. Can you just imagine what a great place? The New Parent Resource Center. All the resources are there,
Yeah.
and there's a huge focus on breastfeeding there. I send a lot of my own patients to Sheila if they have, a clogged duct, or they have, engorgement, sometimes mastitis. I'll treat them with antibiotics, but they need to go to Sheila for the education on how to prevent it happening again. And it's free. Isn't that
Mhm.
amazing? It's free for anyone who delivers in the hospital at
Wow.
community
Yes.
memorials.
Also, just education of like the misconceptions, because I think like how you started with your story as well is so important, because I think I'm my generation, there's still tons of misconceptions or lack of education of what different things that you're
And
doing in your lifestyle that might affect it, or just the social norms and stuff that people base their decisions off of when they end up having a kid later in life. So just having your role is just super important for those. And I do have some questions about some different like misconceptions and things that we can get to later.
Alrighty.
What are some of the pushbacks that you faced to get the different things in motion?
Well, I think in the beginning,
hey, friends, just before we go on any further with this very interesting podcast on breastfeeding, I just want to remind you that we have a link in the description down below where you can ask us questions.
Some of the great questions that are coming up in future episodes are things about C-sections, inductions, negative effects of birth control, and even breastfeeding. So if you guys have more questions, either about Sally or different topics about women's health and pregnancy and labor, please use that link down below and you can ask us to be answered in a future episode.
a lot of the providers, the baby's doctors, thought, who is this person giving advice? Um, and once they got to know
Mm.
who we were, what we did, now my patients will say, "Oh, Doctor So and So told me to come and see what you think." But in the beginning, it was like, why are they telling our patients anything at all? And we've come all the way past that now.
Right.
So that was certainly
Great,
some
great.
pushback, yeah. Um, but I wanted to mention on what Sally said, though. I'm not the only team member there. I have a wonderful staff, and they're all IBCLCs, and each and every one of them are fabulous, absolutely fabulous. And we just did our reviews. We have a little survey that we use for how well we're doing with clients. And I don't know any other organization that has 100% positivity rate, but we do. And the list of comments were pages and pages long, and it's not even one negative.
Wow,
And the reason
wow.
for that is when you enter the New Parent Resource
Oh,
Center, you are treated with just love and compassion from the time you come in. And people feel that. And then, second to that, is that everything they learn there is not because my auntie did this, or grandma said to do this, or a friend said to do this. We actually are educated in the things that really do work. So they know they're getting that good evidence based
mhm.
education and help along the way. There has been a lot of research, and Sally, I'm sure you're very well aware of this, that a woman's ability to breastfeed starts with her feeling like I can do this. And so we're very encouraging. And all of my
Yes.
staff, they're just wonderful. So,
Yes.
and
Yeah.
that's the portion of the New Parent Resource Center is the breastfeeding.
Yeah.
We do about 1,600 private consultations a year,
Ooh,
and
it's a lot.
those we're with the patient at least an hour, so it's pretty encompassing. But as
Yeah.
Sally knows, and Sally is my huge team member there, and talk about the poster child for everybody feeling warm and welcome. Sally is wonderful because you also, in our organization, Sally and I took hypnobirthing together, and she's the
Yeah.
hypnobirthing master and and childbirth educator. And then we have another class that I teach that I wrote the curriculum for called Our Babies Ourselves that takes
Oh,
parents through
yeah.
those first 8 weeks or so of it's an 8-week course of what to expect for themselves and their babies.
Great.
And we have other childbirth educators as well. They're absolutely fabulous too.
Yeah.
So
It takes a
yeah,
village,
we have Well
right?
Mama emotional support.
Yes.
Um,
But
we've
those,
got breastfeeding support
oh,
group,
yes,
which is
the
virtual.
emotional
Those two are
support.
both virtual. So we have a lot going on over there. It's a very popular
Yeah.
place.
It's very popular, and it's very important the work that we do. I think, Sheila, because those first few months when they're at home with their baby, that's the hard part, isn't it? Where they're
Hmm.
exhausted, they can't get to eat or have a shower, and the baby's like, "I want to be fed again." And you teach the tricks, the positioning, the patience, and it all comes together for them. And I know I see the cards stuck all over the walls over there. Thank you, Sheila. You saved my
Oh.
life. You know, like what you taught me, it helped me so much. And I hear it from my own patients. They're always like, thank you for sending me over there. Because sometimes it might be just the way the baby's not latching or is latched wrong. And can you imagine? You get to sit with your patient for an
Hmm.
hour. Oh my God, I would love that. But to watch and to help sort it out, I just think that's the best care. That's the
When you
best.
say that, we have this wonderful uh, uh, helper there at the New Parent Resource Center, Lori, who we all know and love. And she always jokes around. She's the
Yes,
first
love
person they
Lori.
see. She's the person they make the appointments with. She's fabulous. And when they might come in tears and crying, and they leave all smiley and
Oh.
bubbly and feeling confident. And she always says, "Well, we turn that frown upside down."
Oh.
Oh, oh, I love that. And you send them off home with the feeling, I can do
Right.
this. I can do it.
Exactly.
Yeah,
Exactly,
I
because
love that.
that is the most
Mm.
important thing. We cannot help whatever our physical lot is in life with what we've been given. You know, whether the baby has a tongue tie, whether mom has insufficient glandular tissue, or other breastfeeding issues that's making an inadequate milk supply. We can investigate that, do everything that we can for it. But if we could give her that confidence as we're working through it, it makes all the difference. All the difference. So,
Yeah, yeah. Well, that is wonderful. Tell us some of the problems that you come across, like that women just, are just regular little problems.
sure, I would say the biggest percentage of people we see is all about the latch. And we love it when it's a simple fix. And sometimes it is, and their eyes get real big and they go, "Oh, it doesn't hurt." And when Bridget, you talked about,
Oh,
what are some of the misconceptions? Oh my gosh,
Mm-hmm.
some women, they won't breastfeed because they heard your nipples fall off, or it
What?
hurts. It's supposed to hurt. And I
Oh,
can tell
wow.
you, it's never supposed to hurt. There's not supposed to be any nipple trauma at all. And if there is, you should come and see
Yeah.
us because something
Yeah.
is going on with the latch. So
Yeah. Yeah.
Yeah.
But that is something that I hear from moms. I want to breastfeed, but I don't know if I can because I'm worried that my nipples, are going to fall off or it's going to be
Mm-hmm.
very painful. So misconceptions,
Wow, I've never heard of that.
yes, yes.
But
And what's
yeah.
really sad is some women will suffer through it because they think, well, this is just the way it's supposed to be. And
Mm.
then somebody like Sally, your mom, says, why don't you go see them at the new parent resource center? And for the first time they've had a comfortable breastfeeding, and they're absolutely shocked.
Wow.
Yeah.
So let's talk about
Wow. Okay.
what could cause a
Yeah.
painful breastfeeding or nipple trauma.
Yeah.
Um, it's either mom's positioning or it's baby's abilities. And that's, I said,
Mm-hmm.
we're like, the little investigators, because
Detective.
we're
Mm-hmm.
Yeah.
detectives. We're looking at both. And many times, I'll see a mom and she'll come in and I'll say, can you show me how you've been latching? And she's wanting to take and put her hand on the baby's head and just bring the baby's head
Mm-hmm.
straight down onto the breast. And when that happens, I'll show you with my hand. So here's the top and bottom jaw. So here's her breast over here. So she's putting hand on head. So head's coming this way, and it's just dragging and dragging and dragging. And she ends up with a very shallow latch because the baby
Mm.
is only on the nipple. So
Mm-hmm.
when we are able to educate her to bring the chin in and then allow the baby to come up and over, the baby is now pumping the pump and not dragging that nipple anymore. And even if her nipple was already traumatized, she says, "Well, my nipple pain before with nursing was a 9 or a 10, and now it's only a 1 or 2, and it's only a 1 or 2 because
Wow.
it's already kind of sore, but she's not
Yeah.
increasing
Yeah.
the
Yeah.
damage." So that's
Wow.
Great.
simple
Yeah.
fixes on latching. Sometimes
Mm-hmm.
we have babies who, for another reason, cannot bring that tongue forward. And it's the
Mm.
tongue that's protecting the nipple because that nipple
Oh,
needs to
yeah.
go.
Interesting.
Bring your tongue along the roof of your mouth and feel where it goes up and gets soft. That's where the nipple's supposed to
Mm-hmm.
be. But sometimes babies have some restriction in their mouth and they're not able to accomplish that. So maybe they can't get the tongue out. Maybe it's tethered. It's commonly called a tongue tie. Medical term is ankylosing. But maybe that baby's tongue just can't do that. So she's got the gums. The baby's gums are what's really irritating her. Um, and sometimes it's not a tongue tie at all, but baby is so tight up through the neck that that's not
Mm.
allowing that. And that's where
Wow.
we talk about a neck tightness. And sometimes it's only one side. And
Like a
Sally,
torticollis.
some babies have what's called torticollis, which means twisted neck in Latin. And what that means is from their womb position, they're very tight to one side. And we look
Hmm.
in their mouth,
Oh wow.
and sometimes even their gums are misaligning, they're starting to make some changes. But sometimes that tongue cannot function when we get them out of the comfort zone. And so we do a whole evaluation of that too
Yeah.
to figure out what is going on here with
Wonderful.
Wow.
the baby. All right. So
Yeah.
again,
Yeah.
latch is the
Yeah.
biggest reason because moms are coming in. I'd say
Mm-hmm.
second
Hmm.
biggest reason is mom's worried she doesn't have adequate milk, or indeed she does
Mm.
not have adequate milk. And it's really fun when a mom's milk is just coming in and she comes in and she's worried, I don't have any milk. And we teach her how to do a little hand expression. And that milk comes out and she's so excited. And she looks over at her partner and goes, oh, did you see that? Because she came in with the mindset that I don't have any milk. And so that's very,
Oh
very,
wow.
very fun. And then
Amazing.
when we show her how to get that
Yeah.
mouth in the right position to actually move that milk
Mm-hmm.
along, that's also very gratifying
Yeah.
for
Yeah.
her. We use a scale that weighs in
Amazing.
grams rather than pounds and ounces. And so we can actually, a gram is close to a milliliter of fluid. So we can actually show her how much her baby is getting out of feeding and weigh the baby also to just see
Wow.
what
So
the baby
great.
weighs. So yeah, so milk supply is another. Now, sadly, there are some women who during breast development did not have the right hormone in place to make a milk factory. And we call that insufficient glandular tissue. And so that's something else that we're evaluating for. And that is
But
very,
that wouldn't have anything to do with the size of the
not
breast,
at
right?
all, but more the shape.
That, yeah,
So the things that we're
yeah,
looking for is the width between the breasts, the areola, which is the dark part. How big is that compared to the overall breast size? And then we palpate, meaning that we go around and we examine to see does she have glandular tissue all the way around. There are some women that there was a hormonal issue during puberty that they never developed glandular tissue to then be able to develop for full breastfeeding. There are other women that maybe have a smaller issue on this part because of a hormonal reason they had after puberty. And that's again, like you
Mm.
said, we try to fish it out, Sally, um, because we're looking at their hormones. You know, is there a hormonal
Hmm.
reason here
yeah.
that we can fix that's affecting this? And I'll give you an example. um, Women who are on thyroid medication because they have hypothyroid. Many times during pregnancy, as you know, Sally, they will need to increase their thyroid medication for the pregnancy. And
Yeah.
then after the baby's born, maybe they don't need that much anymore. But if they're running too
Hot.
high,
Yeah.
they're not getting their full milk supply. Another
Oh,
hormonal
wow.
issue. And
Okay.
that's why we say go back and get your thyroid stimulating hormone checked. And I've had many a mom who came back, said, oh, yeah, it was too high. They dropped it. I have better milk supply now. Another is,
Ah, I'll be on the lookout for that.
yeah, and another is if there was some small placental fragment. Now that can keep their pregnancy hormone, which is HCG, elevated, and that interferes with
Oh.
prolactin, which is their milk hormone. So,
Hmm.
and moms might come in and say, you know, I have this kind of all of a sudden this gush of blood and what looked like some tissue or something. But if if we don't have that yet, but we're suspecting that, getting that HCG level done is great to lead the provider, like you, Sally, in the right direction of, you know, maybe there's some placental fragments if that HCG is still elevated, because that comes from the placenta
Oh,
that
wow.
interferes with
So
the placenta.
interesting.
Yeah. So those are just a couple. I mean, there's a whole list. I don't go into the whole medical
Yeah.
portion, but those are so low milk supply. We're trying to fish it out. Is it mom's anatomy?
Hmm.
Is it her hormones? Um, or is it the
Mhm.
management of the breastfeeding so far? I had one
Yeah.
mom one time, very wealthy family. They were from another country, and so they flew in some family member that was going to be the baby nurse. And so mom just basically would sleep all night, and the baby nurse would just feed the baby formula. And she kept coming back in, wondering why she had no milk supply. Well, interestingly enough, in order to build a supply, you have to ask for it. And the hormones that make milk, prolactin, they're actually peaking from about 9 p.m. to 3 a.m. in the morning. And so here
Oh,
this mom was
wow.
getting no stimulation. And
Hmm.
and so she didn't put in the order for the milk supply. And
Right.
we have receptor sites in our bodies waiting for hormones. So we want to fill them up with prolactin, and it's by that very frequent feeding. And that's something else we love to tell parents when they say, "Oh, we had such a rough night. The baby ate constantly, from like till about 3 a.m, I say, "You've got such a smart baby," because Mother Nature gave them a
Yeah.
phone call. And they said, do that so you get this good milk supply. And when you normalize that
Wow.
for them, then they don't think they're trying to just get baby back to sleep. They go, look at
Right.
how smart he is. Look
Right.
at how smart. Yeah,
Oh,
Yes.
yeah.
Yeah. And that's part of our education for our parents, to tell them that the goal shouldn't be to sleep all night. They're like, it's a good baby. The baby slept all night. No, your baby needs to feed every 2 to 3 hours, 8 or more in 24. I remember
exactly.
when we
Yeah,
were doing the breastfeeding initiative. Yeah,
right.
yeah. What about, so I have some patients, Sheila, and they have inverted nipples.
Mm.
And when I say, are you planning to breastfeed? They're like, I don't think I'll be able to. And I always say, your nipples are perfect. You don't worry about it. Just wait and see.
I love that answer,
So I
Sally.
bet some,
Do you know why?
oh, good,
If,
oh,
if,
good.
if they saw somebody and they said, oh, breastfeeding is going to be difficult because you have inverted nipples, we've already lost them, right? Because they're
So they
coming,
might not even
Yeah,
try. Yeah.
or they're thinking, oh, it was
yeah,
a little hard. Okay, I guess it just won't work. But when they're given
Right.
that
right.
that you're going to be just fine, that sets
Yes,
the whole mindset different. And did you know that babies don't nurse the nipple?
yeah.
Babies nurse the breast,
Right.
right? Let me show
Oh,
you
yeah.
with
Yes,
my hand. If
yes.
you had an inverted nipple rather than a nipple that stands out, well, remember the baby does this.
Mm-hmm.
So if
Yes.
this is all the baby's ever known, and as they start sucking, they start to pull that nipple out. But if we start sticking artificial nipples in their mouth, then
Mm-hmm.
it's much more
Yeah.
difficult to get a baby on an inverted or a flat nipple because the baby's doing
Right.
this like, where is it? Where is it? Last time I got my belly full, I felt this hard object and I'm not feeling it,
Right.
Yeah.
right?
That
So,
makes
Yeah.
sense.
And Bridget, do you like that? That's called nipple
For the
confusion.
baby. Oh,
Yeah.
little
and you know what?
confused baby.
Do you know
Nipple
what nipple
confusion.
confusion stems from? Is our babies are very smart and they're like, I got a belly
Mm-hmm.
full,
Mm,
right? So I don't know if it's so much
Oh,
confusion,
yeah.
although that is the term, Sally, as you said, is that they have muscle memory, right? So
Right.
when they're on an
mm.
artificial nipple, all they have to do is suck up and down. When they're on the
Oh.
breast, they have to massage it like this.
They,
They're
Oh,
yeah.
wow.
doing
Hmm.
this. So they're looking for
Yes.
a hard object and then they're trying to go up and down and they're not getting anywhere. So we want all of
Yeah.
Wow.
their muscle memory to be with this motion. It's the reason we don't recommend pacifiers
Yes.
until breastfeeding is well
Mm-hmm.
established. We want to strengthen this
Wow.
muscle memory.
Yeah.
And
I remember that so well when I was breastfeeding my Bridget.
Yes.
She would like start the pump and then you can feel the streams of milk flowing through your breast towards the nipple, and then it's just like flowing, and it's such a wonderful feeling, isn't it, Sheila? It's the best.
We do a eating suck,
mm-hmm.
right? On that stimulation,
Yeah,
they're
right.
actually lengthening the nipple. Did you know the nipple lengthens by about two
Mm.
to 2.5 times the length when they're breastfeeding? And it's that
I didn't know
lengthening.
that.
Yeah, and it's the lengthening that causes the hormone, the same hormone that causes labor
Mhm.
contractions, causes that milk ejection. And back to what you were saying, Sally,
Mhm.
um, wasn't it just wonderful breastfeeding your baby?
Oh, it's heaven.
I
The,
always say,
yeah,
they say when you're
I loved
when
it.
you're not in a place you want to be, go back to your favorite memory in the whole wide world. And it's always me sitting there
Yeah,
with my babies in the middle of the night. Everybody else is
me
asleep.
too.
And I'm hearing them go,
Yes.
while that milk is letting down.
Yes.
And they're just looking up at you.
And Bridget's little hand, yes, her little hand used to play with my mole here on my chin.
Yeah.
And I love this mole. I have so many memories breastfeeding with the little finger
Yeah.
on there. Yeah. Of course,
I don't know about
when you're
you, but
breastfeeding,
I'm actually getting chills right now just with the memory of it.
Aw.
I one time was having some dental work done, and I was like, I am going to my favorite place, and I was in my mind
Yeah.
in the middle of the night breastfeeding my babies. My dentist kept going, "Are you okay?
Yeah.
Are you okay? Are you okay?" Because I had meditated so much out of it and hypnotized myself, and I just wanted to tell her, "Would you just leave me alone? I'm in my
Yeah.
Oh
I
my
am feeding
gosh.
my baby. Doesn't matter. I'm in my 40s. I am feeding my baby.
Aw.
My babies are already in their 20s."
Oh, I love that. And of course, when you're breastfeeding, you're secreting your oxytocin hormone, which is
Absolutely.
your love hormone.
Absolutely.
It's
Love
it's the
hormone.
hormone that makes you contract in labor. It's secreted when you're having an orgasm.
Hmm.
It's secreted when you're breastfeeding.
Yeah. So
It's of course it makes you feel so
could you
wonderful.
imagine, Sally? And that's the reason why we know that in labor, when moms become stressed, that their labor stalls, right?
Mm,
So the same thing with
Mm.
breastfeeding.
yes.
When they're tensed up, they're in
Yeah.
pain, or they're thinking this isn't going to work, they're inhibiting their milk letdown.
Yeah.
And so, again, so much
Yeah.
importance of us making them feel comfortable so that milk can just
Wow.
flow,
Yeah.
Yes.
right? So, yeah,
Yes. I remember you telling me that once, and then a patient came in. I was working out in Santa Paula's per diem, where you used to work too. She came in and she was very stressed. The baby wouldn't latch, the milk wouldn't come. So we just put her into a bed and did skin to skin again and got her all quiet and
yeah,
calm, and everybody calmed down. And I often think the baby copies the mood that the
Mm.
mom is in. The baby's like, we're tense or we're angry or, we're happy,
absolutely. We
we're
emotionally
calm.
regulate our babies. But the other
Yeah,
beauty
yeah,
of doing skin to skin is it almost is a reset for baby. So let's say if baby and mom they were having this difficulty and they were just like this and breastfeeding wasn't working and there are all these problems. Um, that's what we do a lot is we just say we're not going to ask anything of you or the baby, but let's get the baby down to just the diaper and on your chest and let's see what the baby wants to do. Because if the babies could start looking, they have this whole maneuver that they do. They use their feet, they use their hands, they use the sides of their face, they use their vision. And as Sally knows, when a woman becomes pregnant, her areolas darken up, right? So that's the
yeah,
babies, they're going by scent and feel. And if we could let them do that rather than us saying, now we're going to put you on, right? Now we're going to
Mm.
yeah,
put you
Yeah.
on the breast. No, that's not what we want to do. We want baby to be a partner in working their way there. And then mom is more relaxed and she's got this warm, cuddly baby on her, and everything just flows
yeah.
better. Then straight away,
And we
baby on.
see it all the time, Sheila. Yeah, we see it all the time in the labor room. Baby's born, we place the baby on the skin, and then the baby, after maybe 30 minutes, they're looking around
Yeah,
and bouncing their
Mm-hmm.
head. And then they see that darker areola and darker nipple, and they'll crawl towards it. We call that the breast crawl. So nice. And when they're doing that, yeah, but when they're doing that, they're moving their little knees
yes,
and feet
yeah,
on the mom's
uh-huh,
uterus, helping it to
yeah.
contract. So wonderful. And then when the baby does latch, streams of oxytocin are produced, and some of it gets down to that uterus and helps it to contract even more. So she holds on to more red blood cells. The
Absolutely.
placenta site gets
And
closed
when the
off.
baby starts suckling, baby's getting that colostrum. And for those of you that don't
Yes.
know, colostrum is different than what we call mature milk. The colostrum is
Mm-hmm.
filled full of antibodies And it's that it comes in
Yeah.
small amounts,
Yeah.
but the baby's tummy is very small. And it's meant to coat that tummy and keep blood sugars where they need to be. And the more out, the more milk is made. So if we could get off
Mhm.
to that start, it just sets up the whole thing. And I wanted to say, Sally, do you remember when we were becoming baby friendly? Well, even before baby friendly, remember when we initiated the skin to skin starts at birth many, many years ago, right?
Yes.
And that was way before
Yes.
baby friendly. And we had some moms back then, more then than now, that might come in and say,
Mhm.
I'm not planning to breastfeed. But we said, well, all of our babies go skin to skin because it helps to moderate their blood sugars, their temperatures, and it does get breastfeeding off to a better start, right? And baby doesn't become stressed because baby's in their habitat.
Mhm.
So we had
Yeah.
Mhm.
so many moms that weren't planning to breastfeed that their babies wiggled on up and latched. And the moms were like, I wasn't going to breastfeed, but now I think I am. Do you remember that?
Oh, wow.
Yeah. I remember. And our breastfeeding rates went way
Yes.
Wow.
up. Yeah.
Yeah. Yeah.
Yeah.
Because that's where
Yeah.
babies
It's
belong,
really
isn't it?
wonderful.
Straight away, a mom, unless there's a
Oh.
medical
Yeah.
need. That's where they need to
Yeah.
Do
be.
you ad-
And now, sorry, go
do
ahead,
you advise
Bridget.
at all about like nutrition as well? Because I would assume that what the mom's eating also directly affects like the quality of the breast milk. Do you advise on that as well?
Up to a certain extent. Now, our bodies are very
Mm-hmm.
interesting because they're really good at making really good milk. And we know that
Mm-hmm.
because, you can look around the world at different times of famine where you had this mom that looked emaciated and this big chubby baby because baby was breastfeeding, right? I mean, we know
Right.
that. But eventually, mom starts to suffer. And to a certain point, maybe then it's hard for her to make milk. So moms need somewhere around 500 extra calories to be breastfeeding, and sometimes depending on mom's size, she might need up to 1,000 extra calories. So there isn't an
Mm.
exact amount, but we want her. I always say, eat like you were still pregnant because you're still nurturing. You're still nurturing this
Right.
baby.
Right.
So make good food choices, not only for your baby but for yourself.
She's going to lose weight even if she's having those extra calories.
Yeah,
She comes into the office and she's like, "Woo!" Back in her skinny jeans, like 8 weeks later.
yeah. So for every
Amazing.
ounce
Yeah.
of breast milk she's making, it's an average of about 20 calories. So babies are
Wow.
eating
Yeah.
25 to 35 ounces a day.
Hmm.
So take that 20 by
Yeah.
25 to 35, and that's how we come up with our numbers.
That's a lot. Yeah.
Uh,
That's a lot.
Periodically, we will
Yeah.
have a mom who does look quite thin, and maybe her baby isn't growing as well. And we try to get her on a diet of good fats, like the
Mm-hmm.
avocado. The avocado has that
Mm.
really good
Hmm.
fat in it, a coconut oil, things like that,
Mm.
that she's getting those good fat calories in.
Healthy
And we've
fats.
seen
Yeah.
babies' weights move up sometimes with that. She's able to make more milk, maybe
Interesting.
fattier milk.
Now, Sheila, what about ladies who have breast
Mm.
implants?
So I would say 90% of them are no issue. And the
Mm.
reason is it has to do with where the incisions were made. And a lot of women these days, they have an implant with breastfeeding being so popular that they haven't disrupted milk ducting. And it's because that's what it's all about. Um, if if they've had an incision around the areola, which is the dark part, there could be this disruption of milk ducts. Now, when we talked about the women that
Right.
have the insufficient glandular tissue, maybe they had implants because they never had a lot of ducting. They didn't like the way
Mm.
that their breast shape
Right.
was, right? So then they had the implants put
Right.
in. And if they didn't have a lot of ducting to begin with, and then we cut even more, then you can see how that could be problematic. So I would say to any woman who's wanting to have any type of breast surgery done, make sure who's ever doing it knows one day I would like to breastfeed. So they're making those
Ooh.
decisions
Yeah.
on where they make the incisions. that they're disrupting as little as
Right.
possible. I've had lots of moms who breastfed and made plenty of milk, but it depends on what did they have it done for
Yeah.
first. And if it was insufficient glandular tissue, well, they still have insufficient glandular tissue. Or if they've cut
Yeah.
around the milk
Interesting.
ducts.
Yeah.
Now, another interesting thing about cutting around that areola is if you guys imagine a clock and you look at 4 o'clock and 8 o'clock, that's where a nerve innervates. And when that
Oh.
nipple
yes.
gets pulled and that oxytocin release happens, well, if that nerve has been cut, that can interfere. So I always ask moms, do you have
Interesting.
sensation in your
Yeah.
nipple? And sometimes you might have more
Yeah.
sensation in one than the other. And we can stimulate the other nipple even
Yeah.
though the baby is on the other side. I could have her stimulate that nipple because oxytocin will still be released. So
Interesting. Yeah.
Yeah.
Very, very
But
What
that's
about
yeah.
I was gonna say, what about nipple piercings? Because I don't have them, but I know a lot of people my age that do have them, and I've heard both sides that they have horrible effects for breastfeeding, and some people say it has no effect, you'll be fine. So I think there's no one better to ask than you if
So
there
the
is an
only thing that
effect.
happens with nipple piercings, which is kind of funny, is it just gives another hole for the milk to come out of.
Okay, wow.
Moms will leak out of the nipple piercing many times, but no,
Okay.
it does not affect their supply in any way.
Okay, that is good to hear.
You'll be doing an
That's good.
exam.
Yeah, that's good.
Yeah.
Yeah, I've heard about scar tissue, and I think that's what scared me, is that it might put scar tissue in the wrong spots and block the duct and stuff.
Yeah.
But that's
Now,
good.
again, if we went back and we looked at a mom and maybe she had insufficient glandular tissue, and then if she did end up doing some damage, maybe that would affect her more than a mom that didn't have insufficient glandular tissue. So, but I've had a lot of moms that had nipple piercings, and they don't have the jewelry in when they come in, but you can see the hole and milk is coming out of it.
That's so interesting. And some women, they come to me and they say, "Oh, I didn't want to breastfeed because my mother had weak bones, and I thought I would get weak bones." But of course, it's the opposite. When you're a breastfeeder, your body lays down more calcium in your
You are
bones.
exactly right.
So you end up with stronger
Exactly
bones.
right. And
Yeah,
that's one of those misconceptions, isn't it? Yeah. Yeah. It's
Yeah,
almost like
definitely.
you actually do
And
bleach the calcium out while you're breastfeeding. You are really using it, and then it comes back stronger. So a mom who is
yes,
breastfed
yeah.
has less chance of osteopenia and osteoporosis.
And less chance of breast cancer as well.
Absolutely.
It
Absolutely.
reduces her risk of breast
Yeah.
cancer.
Yeah.
Now, Sheila, what about ladies who either don't want to breastfeed or really cannot breastfeed? How do you talk to women when they want to bottle feed?
So they really need to be supported. We talked about insufficient glandular tissue. Maybe a mom wanted to
Right.
breastfeed. She's capable to make a certain amount of milk, but maybe not her baby's full milk supply. And I encourage her to meet her breastfeeding goals with that knowledge, because there are some moms that, to give any breast milk is a benefit. So maybe baby always needs to top off with formula or donor milk, but she's still giving up what she has. So that's a personal decision on what she'd like to do. And the most important thing is we're meeting her goals. It's never about our goals. We're not there to say you must do. We're there to say, what would you like to do with this knowledge, and how can we support you? So some moms will make the decision to go ahead and give what they have. And they have all kinds of little feeders, that little tube with a bottle around the neck that baby can be getting the extra, maybe if she doesn't have the full complement of milk. Now there are some moms that say, it just isn't worth it to me, and I'm just not going to do it. And that mom needs to be supported because we need to meet her where she's at and lift her up. And I always tell
Yeah.
moms
Mm-hmm.
the
Right.
amount
And lift her up.
the amount
Yes.
of milk that you make is no indicator of who you are as a mother, right? Has nothing to
Mm-hmm.
do with it,
Or the amount of love you have for your
right?
baby.
So what,
It's just choice.
right?
Yes.
And what's an indicator is that you are keeping your baby fed. You're not allowing your baby to
Mm-hmm.
not
Yes.
get enough nutrition.
Yeah.
So we
Right.
really like
Yeah.
to build moms up. And there are some women who don't want to breastfeed, even if they have everything that it could take physically, they don't have mentally. And that's where we look at, we don't know, maybe mom had a situation in her life to where it's just very uncomfortable, and we're talking about some sort of abuse. And for her, that
Mm-hmm.
is very real to her.
Right.
Some moms will share things with us, not all moms do. But we need to give her what we do any other thing, Sally, in medicine, is the benefits to it. And then say if I'd have known their benefits, I would have breastfed. But if she knows all the benefits and she's just saying, I'm not
Right.
Right.
interested,
Yeah.
it's not fair to us, or
Mm-hmm.
to
Yeah.
her, not to us, to her, to tell her how she's going to feed her baby. So we want to support moms in their feeding choices, but
Yeah.
give them all the
Mm-hmm.
guidance that we can,
Exactly. Great.
to make their
Yes.
feeding choices possible. And we do like to teach them, if they are planning to formula feed, how
Mm-hmm.
to properly mix their formula and
Yes.
store their formula so their baby's being fed safe, and how to deliver the formula to the baby in a safe way.
So
Great.
all of this is so beautiful, and I think your resources are so important. For anybody who's listening to this podcast right now, Sheila, where can they find some of your resources, or like go to the New Parent
Sure.
Resource Center?
So the hospital has this wonderful website called mycmhbaby.org. And as they click on there, they go down to where it says New Parent Resource Center, and it has all of our contact information. And as Sally was
Perfect.
mentioning in the beginning, our moms that deliver there at Community Memorial have this wonderful benefit in that they can see us for their baby's first year of life, and to meet their breastfeeding goals, at no charge. We currently only ask a $50 fee for moms who did not deliver, at Community Memorial. So
Wow,
so it's a very inexpensive
so
comparatively.
wonderful.
And again, they're getting a board certified lactation consultant, for all of their knowledge
Yes.
and care and expertise. So, and Sally's classes are on My CMH Baby also. All of the classes we offer there
Yes.
are on there.
We'll make sure to link
Thank
to that
you.
also in the description below.
But I'd like to just say, Sheila, thank you for your generosity in like as we're having this discussion, you keep on pulling people in and saying it wasn't just me, it was her and it was her and it was all of us. And that's such a beautiful way to be, because of course that is true. But I really feel like you are our driving force behind our success at CMH with the breastfeeding, and our rates are really, really
And I
high.
feel quite the opposite.
I know, because you're humble, but I sometimes like to think of all of those thousands of little babies, who benefited from all of your guidance. You were my teacher, and you still teach me, and you always stay on top of the evidence, and I really appreciate you. Thank you so much.
My pleasure. And can I say, Sally, I remember when we first met, and you were wanting to do prenatal yoga, and we didn't have prenatal yoga. And you started doing prenatal yoga, and everybody just loved it. It was wonderful, and everybody still just loves it, and your spirit. And when we talk about the New Parent Resource Center, it's not only people from administration, Megan, who administratively made this possible, but everybody that works there. Everybody that works there has given it the stellar reputation that it has. You included. And Bridget, I'm sure you know your mom is quite popular.
She is. But
we all love
just
Sally.
I love Sally. It. Yeah. It's because of, so many different passions and just relentlessly doing it, as much as you can. So that's why you're my role model too, Mom.
Oh, thanks, Bridgie. I have a feeling, Sheila, Bridgie's going to try breastfeeding.
Not yet. No reason to.
But not yet.
And you know, Sheila too. If you have any issues at all, I have friends, and I do virtual consults with my high school friends' kids. Because they lived in another state.
I actually live in Texas now, so that's probably what I would need.
I know.
Yeah, and
we just get on a media, and I'm just showing you everything.
Yes.
And, so feel free to always reach out to me.
Thank you. And maybe if we have another opportunity, you could come back on the podcast, because I feel like this conversation could go on forever. It's really important, I think, also that you emphasized you're not just there for the women who want to do breastfeeding better or have small problems, but for any woman who has, any type of, question or concern or needing support for themselves and their baby. So I think that's overall just amazing.
Yeah, I agree.
Absolutely.
I second that.
Do you know, we all have one start in life, right? Mm-hmm. And if our parent could feel very confident and supported and uplifted, and when things aren't going well, she has some resources for her, it makes all the difference, doesn't it?
Yes, it really does.
Yeah. All right. So thank you, Sheila, for joining us. And if you guys are listening, please make sure to give our podcast a like, a subscribe, and make sure to hit the notification bell so you don't miss any of our future episodes. And we'll see you in the next one.
Thanks a million.
And Sally and I always do this to each other.